We have Houston-based cosmetic surgeon Dr. Nikko here joining us to answer a few questions regarding breast reduction surgery. Our first question comes from Stephanie, who says, I'm having back problems and would like a breast reduction. If I have the surgery, will it be permanent or will my breast come back?
Okay. Typically, Stephanie, when we do a breast reduction, normally the breast is fully developed. So when we remove the breast tissue from your body, it's gone. I mean, it's completely gone. Now, when you say, does it come back? If you experience weight gain, your other breast that's still there could get larger. But if you don't gain weight, then it should not come back. Your breast will not get bigger, typically. So if you don't gain weight, then I wouldn't worry about having to have another one in the future.
This next question comes from Beverly, who asks, how is the surgery performed?
Yes. Beverly, basically the idea of breast reduction is there's different techniques. Now, it essentially is the removal of the heavy breast tissue that's hanging on the bottom. And we use flaps. And so not to get too technical, but basically we're recreating the shape of the breast by using the tissue that's left and moving it around and kind of like a puzzle, putting it back together. Now, the technique that I use, I don't remove the nipple areola. I just basically rotate it and bring it up. So there's minimal loss of sensation with that. And so you shouldn't have to worry about that. But essentially is you take it out what you don't want, which is typically on the bottom, and you're kind of recreating the breast shape by putting everything else together using tissue flaps.
Maria says she would like a breast reduction, but travels for work quite frequently. How long will it take to recover enough to go back to work?
Yeah. If she travels, I assume she has to carry luggages, lift heavy things, so I would tell her 2 weeks. Now, if she doesn't, she can go back to work in 3 to 7 days, okay? She's not gonna be 100%, but well enough to do, drive, do desk work. But if she travels, you want to be at least 2 weeks out. If she can, a month out would be better. But we have some people who are busy and they got to get back on the road. And as long as 2 weeks out, I know they're safe.
This next question is from Jamie, who says, I've never had any plastic surgery, but I have decided to get a reduction. If I show you pictures of the size I want, can you match that? And how does that work?
Yeah. So, Jamie, I believe asked that question. Jamie, that's a great question. Now, showing a picture of what you want is key. That's part of our consultation, understanding what you want, spending time understanding what shape you want, what you expect. I mean, that's the majority of the consultation is understanding what shape you want. Do you want a little cleavage, the size you want? And then from that, I can basically, then I know looking at your breast that I know how much I have to remove. I know what I need to do. So yes, having a photograph, even if you don't have a photograph, we'll probably spend time photoshopping a photograph of what your breast will look like on your body. So that way it'll help communicate. And as much as possible, try to avoid misunderstandings or other things that weren't communicated.
Well, that sounds like a great tool to have for the patient to be able to use as well.
Yes, it's great. It allows us to communicate with each other, and we can describe, again, breast size. And there's no consistent breast size. Someone thinks they're a C and they may be a D. Someone wears a D bra and they may actually go to another store and buy a C bra. So bra size doesn't help. Using photographs and using Photoshop and listening to the patient and kind of working through that. It's a process, but that just gives us, in my experience, the best chance of achieving what the patient wants.
Yolanda asks, when will I find out how much it costs to have a reduction?
Yes, again, the cost of a breast reduction again, completely depend on the amount of breast tissue that needs to be removed. Small breast reduction, minus OR anesthesia, you can start out by, small reduction, but about 4,000 or so. But majority of people, though, when they want a reduction, it's they have neck pain, they have back pain, and so it's a kind of a big procedure. You're talking about a 3-4 hour procedure, and depending on the breast size, and that can run up to maybe $8,000. It just depends on the patient, and when I see them, then I can give a more exact number. But you're looking around that range, and that should help.
Darlene wants to know, what type of scarring should I anticipate from a reduction, and where would the scars be?
Yeah, that's the most common question with breast reduction. The scarring. Unfortunately, we have to remove the tissue. We have to cut. There are some patients where I can do liposuction, believe it or not, and get the patient, the breast to shrink and get it to come up a little bit. But that's the few. The majority of patients, we need to remove that tissue by excision. So obviously there's going to be scarring involved. Typically, you're looking at the scarring around the areola, okay, and it will run down the middle of the breast, and then you'll have it kind of hiding underneath. So the extent of the one hiding underneath the breast will depend on how much tissue we're removing. Most of my patients that come in for breast reduction, they're looking for a big change. So typically, you are looking at that whole, what we call the anchor scar, and but patients that are getting breast reduction, I can tell you, I've never had a patient that went through a breast reduction that was unhappy about the scars. One, we do a lot of things to make the scar look good, okay? And two, if the patient keloids or have hypertrophic scars, we do what we can without additional costs. We see the patients for another 6 months, up to 9 months, to inject steroids into that to make it look better. That's just part of our aftercare. And then most patients are not bothered by it. They heal really nicely, and they're not bothered by the tiny defined line scars, because they're just happy to be able to exercise. They're happy to be able to just live a normal life and not have the neck and shoulder pain. And most importantly, they're happy to be able to wear the things that they want to wear and not feel so top heavy. And so the incisions are very minor for them. But to answer your question, it is most likely the anchor scar.
This final question comes from Denise, who says, I'm pleased with the shape of my breast, but they're too large. If I get a reduction, will it affect the shape? And will it affect my nipple? Also, will I lose sensation in my nipples?
Yeah. Let me answer the last one first, because that's the one that people ask a lot about. And again, like as I said earlier, we don't use the free nipple graft technique. We use the flap technique. So there's very mild changes. We don't remove it. So there's very mild changes in the nipple areola. So you should not lose sensation to your nipple areola. I luckily never had, and there's always that chance. Luckily, I've never had that happen to me. Now, there's always that possibility, but fortunately, the technique that I use, patients never had loss of sensation. I had one patient that maybe took a year out to get sensation back, but that's not uncommon. Now, the shape of the breast. Most people who come in, now obviously, when they say they want a breast reduction, but they like the shape, but most people with large breasts have breasts that are hanging down. So when she says she likes the shape, I'm thinking she likes the natural shape, but not how it's hanging down. So if you like that natural shape, you're still going to retain that with the breast lift, breast reduction, I mean.
I'm sure knowing that will put a lot of women at ease who are considering that procedure. Thank you so much, Dr. Nikko, for answering these questions about breast reduction.
Thank you very much. And you have any further questions or want us to evaluate and help you through it, I would love to help. The number is 713-960-1311. Just give us a call. Appreciate it.
You can also comment in the comment box below this video if you have any further questions, and Dr. Nikko will get back to you with those answers as well.